Welcome, Kim Prescott from Prescott HR. Thanks, Kim. Let's hear what you've got.
Thank you for joining me for this presentation today. We are facing some very challenging times that we haven't seen before. And I think from an HR perspective, it's important for business owners and executives to understand really what some of the obligations are and to get some clarity on some of the considerations that you need to have as we are coming out of this pandemic. I think we're approaching a time now where people are starting to consider bringing employees back. Some people are making decisions about whether they're going to come back at all. So the purpose of this presentation is really to help employers to understand what things they need to think about. We're going to talk about some safety considerations, some best practices, and then answer a few other questions. Hopefully what you'll walk away with is some practical items that you can take with you to consider and talk with your management team about as you think about what your next steps are coming out of this pandemic. So if you currently have some employees that you've either laid off or furloughed and you are thinking that you're ready to bring some of them back, some of you may have received some Paycheck Protection Plan, PPP money, which says that you need to bring your people back and you're thinking, okay, I'm going to bring people back. Or you may be looking at the phased approach to returning employees and you're thinking, okay, when we get to phase 1, phase 2, phase 3, you're one of those businesses that can come back. How do I do that? What does that look like? So some things that you might want to think about are how are you going to select the employees that you bring back and what are the EEO implications? And EEO being the Equal Employment Opportunity and really the Equal Employment Opportunity Commission is the agency that enforces any decisions that could be deemed to be discriminatory or not. So you just want to think about that. And what are those things that you need to think about? You know, who am I bringing back? Is there an adverse impact to any protected group of people? Just really thinking about what would it look like if I brought back certain individuals and not others? And what would the optics look like? And be clear, it's really not about whether it's intentional or not. It is really about the optics and what does it look like and what would people take away from it. You also have to think about, you know, while you may be well-intentioned, if you're thinking, well, I don't want to bring this person back because they're in a higher risk group, whether it's that they're older, whether it's that they're pregnant, you really can't make your decisions on who you're going to bring back based on those considerations, because there could be some Americans with Disabilities Act implications, there could be some Age Discrimination and Employment Act implications, and you really don't want to have those. So when you think about it, identify who are your essential individuals, what are the departments or the roles and positions, and think about it like that. Think about the roles, positions, and departments, not necessarily about people themselves. And think about who would those people be, what would those departments be, and how do I bring those people back? And if you speak to one of those people and they happen to be in a higher risk group, then they have the opportunity to say whether or not they're able to come back to work. But that should not be a decision or even a consideration that you make. Some best practices around thinking about who you bring back is, again, identifying what is essential to run the business. So, of course, you're going to need your leadership team. You're going to, if you are an organization that, does sales, you're going to need to bring back some of your sales force. You may need to bring back someone in accounting to make sure that you're getting, the bills paid, or that you're receiving checks. More importantly, that you have somebody there to handle your receivables, right? So thinking about that. And then another thing that you can consider is seniority. So seniority is something that a lot of organizations consider when they are making employment actions. And that has, in most instances, been deemed to be a fair way to assess an employment practice. So if you wanted to bring back individuals in a department or a division that were more senior outside the leadership team, that would be something that you could consider. The other thing that you want to think about as you are bringing people back or thinking about how you're going to bring people back is, what is your communication plan? You really want to have a good communication plan, and you really want to make sure that you are intentional about your communication. Team, as we approach X date, we are considering bringing back X% of our workforce, and that would include certain departments or certain levels of the organization. You want to make sure you communicate that to everyone. Now, you may want to communicate to the people who are returning prior to communicating to the people who are not, but you don't want to leave people in the dark. You want to make sure that you're communicating to your whole workforce, because if you only tell the people who are coming back, the people who aren't coming back don't know really where they stand. So you want to make sure that you're clear. While some of you may not be coming back at this time, it is our intention in phase 3 that we will bring back other individuals, or it could be we don't know when we're going to bring back certain positions. But it is important to make sure that you communicate what your intentions are and do so clearly and with intention. The last thing to consider, and quite honestly, just the last thing on this slide, there are so many things to consider, but is to make sure that you have an onboarding process in place. People have been gone. Some of them have been gone for 2 months. What is it going to look like? You're going to, depending on if you laid them off or if you furloughed them. So if you furloughed them, they were still active employees. They just reduced their hours. So you may not have paperwork that you need to do with them, but there's going to still need to be an onboarding process and an orientation to this new workplace. And we'll talk in the next couple of slides about what this new workplace looks like, but it would include social distancing, PPE, and some other things. So you're going to want to make sure that you onboard these employees properly to their new workplace. If you laid them off, that means you terminated the employment relationship and you will need to rehire these employees, okay? So then that means you're going to have to do a new I-9, you're going to have to do all of their onboarding again. And so you want to make sure that you're prepared for that and that you know the difference. You want to make sure that you are very clear on which employment action you took at the time that you either laid them off or furloughed them, so that you take the correct actions and take the correct steps when you come back. If you aren't sure, please work with your human resources professional or engage a human resources professional if you do not have one, or speak with your attorney just to make sure that you have followed the proper process to bring people back to work. So the next thing that we're going to talk about are some of the safety considerations. So you're bringing people back to work. The employment landscape has changed so significantly, right? And so people are concerned, people aren't sure. And really, in order to make people feel comfortable coming back to work, you want to make sure that you have thought about the safety concerns that individuals may have so that they have a sense of comfort returning to work, okay? So some things that you want to think about are, A, are the people that are returning, are they symptom-free? And you may ask individuals if they are exhibiting symptoms. You may also ask them if they tested positive for COVID-19 during the period of time when they were not actively working. And if those individuals say, yes, I did suffer from COVID-19, I had symptoms, I was required to quarantine by my doctor, and I am no longer exhibiting symptoms, it is acceptable for you to ask for a doctor's clearance before you allow that individual to return to work. You don't have to feel that you're not able to ask those questions, because it's important to do so, because if we don't ask, we won't have any sense of understanding what people are bringing into the workplace. You also want to make sure that you are clearly communicating your safety expectations. So if you expect that individuals will wear face masks, if you expect that they will change their gloves so often, if you expect that they will wash their hands in certain intervals and a certain frequency, you want to make sure that you communicate that and document that. Communicate it regularly. This is going to be new for people, many of these new safety routines. So if you have to go over it at the beginning of every shift, every day for the next 2 or 3 weeks, it may feel burdensome, it may feel overwhelming, but it takes 21 days to form a habit. And people are not in the habit of doing some of these things in the workplace. So we want to make sure that we're continuing to communicate that. You may also take individuals' temperatures. When they come to work, when they start their shift, you can take their temperature. The EEOC has said that while that is typically considered a medical exam, it is permissible now during this COVID-19 phase that we are going through. You do want to make sure that you have some type of standard and expectation. So you need to say, anyone who has a temperature over 99.5 or whatever it is that you decide, that you communicate what you are going to be measuring against and what the action will be if individuals have a temperature that is higher than what you have established is acceptable. You also have to be consistent. It can't just be for some people. If you're checking temperatures, you have to check everyone's temperature. If you say that it's 99.5, then it's 99.5 for everyone. You can't make exceptions. You want to make sure that employees who are exhibiting symptoms, even if it's during the day. So if someone starts to cough, if someone starts to feel sick, starts to have shivers or body aches, starts to exhibit any symptoms of COVID-19, you should ask them to go home. You don't want them to continue to be in the workplace for the remainder of their shift even. If they start to exhibit symptoms, ask them to please go home. And then you would follow up with them after and determine what your next steps would be. If they continue to exhibit symptoms, you would want them to stay away for at least 14 days. And then, of course, that's when you would need to start to think about whether or not that individual is on some type of leave under the Families First Coronavirus Response Act, the FFCRA. But more importantly, it's important from a safety perspective to remove them from the workplace. You want to make sure that you're advising employees on proper hand washing techniques. Now, I know you think, I employ adults. Why do I need to tell adults how to wash their hands? Well, the reality is that proper hand washing techniques are not utilized by everyone. So you may want to consider having those, OSHA hand washing posters in the bathrooms and common areas where there are sinks where people can wash their hands. You may want to consider doing that because it will just be a reminder to people how long they need to wash their hands, the temperature of the water, and just the proper techniques. And that will also just serve as a reminder to make people just be more conscious of it. And so those are some of the things that you can consider. Some additional safety considerations would be to have all employees use face coverings during their shift, during the day as they interact with each other. And if you do require this, which in public places now in Maryland, face coverings are required, you need to make sure that you are strictly enforcing it. The only thing that you may have to do is to consider someone who may need an accommodation under the ADA. And if someone is unable to wear a face covering due to a medical condition, you would want to consult with a human resources professional or an attorney to determine the best way to accommodate that. Because someone not wearing a face covering in the workplace could pose a risk to both them and others. So it would be important to make sure on a case-by-case basis that you address that. Social distancing should be practiced in the workplace. If it's possible for you to stagger shifts, to schedule alternate work days, anything that you can do to limit the number of people in the workplace and still allow for the work to continue would be beneficial. you really want to give some thought to that in advance from a scheduling perspective and identifying how work can get done with fewer people in the office. You may want to also consider closing common areas in the workplace, lunchrooms, time clock stations, if you have a fitness center, any place in the workplace where someone would gather, you would want to limit access to those places so that people do not gather because social distancing would dictate that those individuals remain 6 feet apart at a minimum. And those places do not typically allow for that, as well as you want to think about any shared equipment, supplies, workstations, anything that multiple individuals may access, you want to limit that. So if possible, whether it's a cash register, whether it is a computer, or any other type of supply, limit the sharing of those when possible. So having fewer people on a ship would definitely lend itself toward the ability to do that. But if you have the ability to do it in other ways, it is something that you should consider. Additionally, if you are able to erect physical barriers, making the walls higher on cubicles, putting in the plexiglass shields. I actually had not been inside of a store in about 5 or 6 weeks. And so I went to Costco yesterday and I saw they had the plexiglass shields in front of all of the cash registers. And I thought that was really a good way to kind of help create an additional barrier between the employee and the customer. So again, everyone else has probably seen them. I have not been out in public, so that was my first time experiencing it. But it was good to see that there were safety precautions that were put in place. And so while you may not be able to put a plexiglass shield in place, if you have other ways to create barriers, that would be very helpful to consider. If possible, if you're in an office space or in a space where where the public can't access it, prop open doors during business hours inside the building, not the external doors for people to get in, but inside the building, such as office doors or corridors, so that people don't have to touch doorknobs as often. That would be helpful. If people don't have to touch doorknobs or things of that nature as often, then that can also help with some safety. And we've already discussed the shared office supplies. So when you have the people coming in, again, they may be concerned, but the more safety precautions that you put in place and the better your onboarding process and outlining what your plans are going into bringing these individuals back, the more likely individuals will feel comfortable coming into the workplace. However, OSHA has stated that employees may refuse to work if they feel that they are in imminent danger. However, there are limitations to imminent danger. It means that they have to have an immediate, they have to feel that they are in immediate physical danger. So just a generalized concern that COVID-19 is in the world may not qualify as imminent danger. Now, if an individual in your workplace has been diagnosed with the illness, that may qualify. So as it relates to individuals not feeling comfortable coming back to work or refusing work, you'll want to address this on a case-by-case basis. You'll want to consult a human resources professional or an attorney when determining the best way to handle this situation, because they do have some protections employees do, and you want to make sure that you are setting yourself up for success in handling these situations. If possible, allow employees to continue to work remotely as much as possible. If it's possible for individuals to continue to work remotely, consider doing that. And if individuals have previously engaged in business travel or going to client sites and meetings as a part of their daily work routine, I would consider continuing to hold off on those activities If meetings and client visits can be done via video meetings, I would highly encourage that you do those and limit travel or visiting outside organizations until we have gotten to a place where that is something that would be less risky. And then you really need to think about what your protocol will be if you have someone who has returned to work and then tests positive for COVID-19. What will you do? How will you handle that? Some things to consider is, of course, removing that individual from the workplace and identifying any areas that they may have come in contact with. You want to make sure that you have a clear process for how you will clean and sanitize that particular area. And then you need to notify employees that they may have been exposed. It's important to note that for privacy reasons, you cannot tell people who tested positive. What you can do is let them know that someone in the workplace has tested positive and that they may have been exposed. On my website, I do have a template for how you would be able to notify employees. And on our last slide, I'll also provide you with several resources and templates that will allow you to implement many of the things that we're talking about today. So you're bringing people back, you got all these new processes that you're doing, new procedures, safety stuff, new laws have passed. What do you need to do to make sure that people understand this new landscape? Well, you'll want to update your policies. You want to first start with your paid state sick leave laws and make sure that they're up to date. If you have not updated your handbook to include the Maryland Healthy Working Families Act, also known as the Earned Safe and Sick Leave policy, if you haven't done that, please make sure that you update your policies to include that. If you're less than 15 employees, that leave is unpaid, but you still have a requirement to pay. To allow the leave. You don't have to pay it under 15 employees, but you do have an obligation to allow the leave. So make sure that that policy is up to date. You'll also want to amend your leave policies to include the Families First Coronavirus Response Act. That act went into place on April 1st of this year, and it is intended to provide paid leave for employees who are experiencing symptoms of COVID-19 or are required to self-quarantine as a result of a doctor's request or caring for a family member with the virus. It is also intended to provide paid leave for individuals who are caring for their children who are out of school during this time. However, if you are an employer under 50, you can apply for an exemption for the paid leave for the child care piece of the leave. However, the actual sick leave part, there is no exemption. You'll want to look at your remote work policies. Prior to this, many organizations did not have a formal remote work policy. And so they really hadn't given any thought to what that would look like. We've had a couple of months to practice. So now think about how you will formalize that as you may have individuals who continue to work remotely, creating policies and potentially even remote work agreements that you would give to different individuals, outlining what the expectations are as they continue to work remotely. You'll also want to revise your safety policies to include social distancing, facial coverings, and any other safety procedures that you've put in place. You'll want to update your safety policies to include that as well. You'll also want to make sure that you reinforce your harassment policies. New Jersey has passed COVID-19 as a protected class, and there are a couple of other states that are considering it. However, in the news, we have heard that there have been individuals who have been targeted as a result of COVID-19, and you want to make sure that you reinforce your harassment policy and that you review the protected classes and make sure that they are up to date in your handbook. So, best practices for implementing the Families First Coronavirus Act is to make sure that you have a policy for it. I do have a sample policy that I will share with you. And then it's important that you have a leave request form specifically for the Families First Coronavirus Act. The two types of leave that are covered under the FFCRA, the two types of leave are the emergency paid sick leave and the emergency family medical leave. The Department of Labor has given some guidance on what information should be included in those requests. And I have some templates for you that will cover all of the elements that were included in the DOL guidance for those two types of leave requests. So when individuals want to take advantage of that leave, you can use this form to track the request. You want to also track the leave as people take it. It is a best practice to consider creating payroll codes that will allow you to track the use of leave as people take it. So, for example, if someone were to go out on emergency paid sick leave, if they were to contract the virus and they had to go home and they were out for 4 weeks, the first 2 weeks would be the employee paid sick leave, the EPSL, and the second 2 weeks would be EFML, both paid at different rates. So if you had payroll codes that were called EPSL or EFML, then you would pay those people using those pay codes, and then you would be able to track the leave that you have paid those individuals. In the event that for some reason someone challenged the fact that they were paid properly or challenged the fact that they were afforded their rights under those regulations, you would be able to easily track and show that. Additionally, because there will be tax credits provided for employers that provide this leave, it will also allow you to easily track your track payments that you've made to employees in submitting for those tax credits. The other thing is that you want to make sure that you are training your managers. Many managers have not had to manage through the amount of requests for time off and the requests for accommodations that they will see in the coming weeks and months as we return people to work in this environment. So making sure that your managers understand their responsibilities and, quite honestly, helping them to understand that at a minimum, they should escalate these issues to human resources so that an individual who understands the interplay of all of these regulations would be able to help guide the organization and manage the risk of the organization. Because sometimes it's a manager's first instinct to say, hey, either you come to work or you don't. Unfortunately, we have to have a little bit more flexibility, and understanding the regulations will help with that. And that's where training of managers will come in. So some additional information to note is that Maryland, through the Department of Labor, has a work share program. And what the work share program will do will allow for employers to spread the amount of work that they have across more employees, and the employees would be able to work a certain number of hours, and then they would be able to apply for unemployment to offset the amount of hours that are not covered through the work share program. There's more information about how the work share program works on the DOL's website, and I have that link for you on our next slide. It is important to note that in order to participate in the work share program, the employer has to apply and be accepted into the program. And all of that information will be available on the link on the website, which I have a link to on our next slide. But, a lot of this information that I've given today has been geared toward bringing people back and continuing to have operations for your business. But what if you need to lay off individuals, furlough, or close altogether? What if you've come to that point? How do you create a smooth transition? Well, it's important to understand what your obligations are depending on if it's a layoff or a furlough, and then identifying if you're going to offer any transition pay, any severance. It's important to understand what your paid time off policies are in your handbook and whether you have stated that you are going to pay out any time off. And then it will be also important to create a letter that you give to employees, despite whether you offer a severance or not, even if it's not a severance agreement, but a letter to help employees understand what steps they can take. What about unemployment? How do I file unemployment? If you're not an employer that's large enough for COBRA, perhaps just letting them know about their options for obtaining health insurance outside of your organization, helping them to understand when they'll be paid for any paid time off, and if you have any transition services that are available to them. Really just providing them with a list of resources so that when they leave, they're not just left sitting there wondering what they do. Maryland has created a mechanism if you lay off or terminate more than 25 people at one time, the employer can do a batch unemployment claim, a bulk unemployment claim on behalf of the employees. So if you have to remove more than 25 people, a representative of your company can file unemployment the employees on their behalf, which will be helpful for them. And then you can communicate to them that that has already been done. And if you are growing, if this time has caused you to grow and you need more bandwidth, what are the things that you should consider? You should consider all of those safety considerations. Again, making sure that you are thinking about the social distancing and putting in as many safety considerations as possible. And you should also leverage, if you are looking for staff, you should leverage the Maryland One-Stop Centers and the Workforce Development Centers, as many of the individuals who have filed for unemployment are now registered with those facilities, and they have candidates that they have vetted and are working with that could be ready to go. So if you're looking for a workforce and some people to supplement your workforce, that would be a great resource for you. And then again, thinking about all of the things that we've discussed, such as your policies, training managers, setting expectations, onboarding new employees, and making sure that you have considered all of those things and creating a safe work environment as you bring employees in to help your operation. So my hope is that this was information for you that was practical and useful. I do have some resources, and these will be available as links in the presentation. You can go to the Prescott HR resources page. We do have a COVID-19 resources page, which has templates, sample policies, letters, and a variety of other links to government agencies to support the COVID-19 effort for employers. And also here on this site, there is a link to the EEOC's COVID-19 webinar. The EEOC created a webinar last month that outlined some considerations for employers and answered some very good questions. The webinar is about 45 minutes long. It's not too long, and it really has a lot of great information. The next link is the Department of Labor's FFCRA Q&A. It really is in-depth. I think now they're up to about 80 questions on there, but it answers a lot of questions for employers about the interplay between the different types of leave and their requirements based on the size of the organization. Here's a couple of templates that are also found on my website: the FFCRA leave request form, the recall letter from furlough, so if you're recalling someone, a letter that you can give them, and then an employee notice of face coverings in the workplace letter. Those can also be found on the Prescott HR COVID resource page. And then finally, the Maryland DOL WorkShare FAQ. This is a link to the Maryland Department of Labor website where they talk about the details of the WorkShare program and answer some commonly asked questions from employers. So I hope that this information has been helpful to you. If you continue to have questions, we are available for you as a resource. And I thank Nicole and her team for allowing me to present.
Thank you so much, Kim. I really appreciate you doing this for myself and my clients, and hopefully we can get some of them over to you to help them work through some of this. I did have a couple of questions. If you have a couple seconds left, I'd like to try to run through some of them. If you
Sure.
send someone home from work because they have symptoms appearing, and we don't have a doctor's note or a test or any of that available, is that going to still be leave covered under the FFCRA, or do we need to get, do you know, maybe it's in those 80 questions at the DOL, but is that going to qualify? How do we take care of the payment for those hours that we've basically taken away from them?
Yeah, so the DOL has been updating the Q&As around the FFCRA. So, but because doctors and hospitals are very overwhelmed at this time, getting a doctor's note could take a little bit of time. The recommendation is if someone is exhibiting symptoms and they begin to self-quarantine, that you should initially treat it as if it is covered under FFCRA. The individual at a minimum should go to an urgent care facility, which is easier to access, and and get a doctor's documentation on whether or not they should continue to quarantine. Most urgent care facilities are not providing the test, and everyone is not approved to take the test. Because even for the testing facilities, you have to get pre-authorization to go to the testing facilities. So, based on the most recent DOL recommendations, you should treat it as if the individual is going out on FFCRA leave.
Okay, great. And then I'm going to fast forward a little bit to your remote leave discussion. And so I think something that has come up even just for myself and my own team is how do you, how would you best, or what ways do you employ to track the productivity of your staff that is telecommuting? You know, clearly I've got, most of us have some kind of an audit log as it relates to the different systems they might be in, but in my industry, we spend a lot of time researching and pulling things that aren't necessarily tracked from a click standpoint. So how would you best put a policy in place to manage that time so that we're not paying for, you know, hours that are not worked clearly?
Sure. So a couple of things just to note prior to me answering that piece is that employers need to, during this time, be a bit more flexible around productivity expectation, because employees are balancing many things that they weren't balancing before. Many of them have children at home, children that are doing schoolwork during the day, and so they have obligations that would be different than those of the traditional remote work arrangement. With that in mind, though, you, as an employer, should create metrics and deliverables for your employees. So something that is tangible. So, for example, with your example, Nicole, that there's a lot of research that may need to get done, and something that may not, result in a tangible item. Really just having the individual outline what they spent their time doing. I spent 45 minutes researching X, and then I spent 35 minutes researching Y. Perhaps just having them identify a log of things. If an individual is in a role that is a productivity-based role, then setting the metrics and the deliverables for those. Again, keeping in mind the amount of flexibility that may be needed during this time.
That was a great answer for that, because I too have seen the obvious pull as it relates to the balancing act that we're all trying to perform at home. So one last question, and maybe it's more of an opinion, and then an opinion for sure that I'm going to ask you for is technology and the implementation of that, even from a small group perspective, maybe the 2 to 50 range that we've been really focusing on in these discussions. How important would you say as an HR person it is to have that technology in place specific to that size?
Yeah, it's very important to have technology available, in my opinion. Um, Technology, the beauty of it is that, unlike even 10 years ago when you had to buy software and you had to invest thousands of dollars for each person to have a license on their computer, now things are cloud based, subscription based, and the cost to an employer could be as low as $10 per employee. And so when you think about that and you balance that against the ROI of the efficiency of them getting the work done, I think that the business case is there for individuals to have the technology available to them.
Yeah, I think that that's been something that we've been really trying to focus on, not just from the efficiency standpoint too, but the compliance standpoint. Just being able to make sure that you have all of those documents in an accessible place for those employees. Going forward with this, what kind of, I guess what I'm looking at is the burden that you think might be created by the administration of these policies. Obviously, I think with technology, it's not going to be as burdensome, but without that technology, I think it's going to be extremely burdensome to try to manage leave policies and such, using Excel and whiteboard, if you will. What is your opinion on this? Is it something that can be managed without technology, or do you just strongly suggest against it?
I strongly suggest that businesses look at a product that allows them to manage those things through an automated approach. So whether it is a payroll system that has an HRIS bundled into it, some type of system that does the tracking, accrual, and management of the leave rules for them is always going to be something that I would push for, because it only takes you for getting to update that spreadsheet once or twice, and then you can't figure out where you are in someone's leave accrual is wrong for years. I can't tell you how many times I've seen where people are just like, our accruals have been wrong for years. And so, again, the investment of technology, and when you really look at the cost, $5 per employee per payroll, or whatever the cost may be, when you look at that, and it takes some of the administrative time away. So how much time are you spending? If you have an employee that makes $25 an hour that's taking 6 hours a month to do that work, that's $150 a month of time, and that in 6 hours that could be used towards something else, when that money could have been applied to some type of software that could have done it for you and created an audit trail and done some other things for you. So I will honestly say that I will always strongly recommend some type of system that will manage those rules and policies for you and house all of your data as well.
Thank you so much. I really appreciate it. We definitely will be talking soon, I'm sure, as I love to give you a phone call every time I get new rules that I'm questioning. So I hope that my clients will do the same. I believe that you are a wonderful asset to the HR world, and I hope everybody takes advantage of access to you. So thank you so much, Kim, for joining us and doing this meeting for us. And I will hope to talk to you soon.
Absolutely.